According to statistics from Kapchora, Kwen, Buko, and Amdat, over 300 children have fallen victim of the deadly illness, putting medical professions in the region on tension. The illness, which attacks the human bone and the ligament, cripples the individuals. It enters the human body through fresh wound openings on the skin, then into the blood system. Khalid Cherolimo, an orthopedic officer at Kapchora Hospital, explains.
Chronic osteomyelitis is one of the bone conditions that is causing disability most of the time here in Kapchora in particular. And we are saying the cause of this infection is a bacterial infection that enters through the bloodstream through any cut of your skin.
The officials are now worried of the rising number of cases. This year alone, over 300 cases have been identified, with over 40 cases in serious condition for surgery. In other cases, the victims stay at home without reporting the symptoms, leaving the health workers with no choice but to project the number of victims.
When we went to outreach clinics, we reached about 350 children during the outreach clinics, in total from the 4 districts. But there were those critical cases that we had to single out for the operation. The operations are still going on. This is the first one we have done. We are going to organize for another one because the number is so big.
In other cases, traditional birth attendants are said to have also contributed to the problem, especially where the child is not properly handled at birth. Margaret Atiye from Uganda Society for the Disabled says that unless mothers start giving birth in hospitals, especially around this time where the illness is rampant, more cases will be registered.
The mothers, they only come to the hospital when a problem has occurred. But what they do, they just do it from home, from the traditional birth attendants. But when a complication arises is when they rush to the hospital. So by the time they come to the hospital, it is already worse.
Kapchora Hospital handles most of the acute cases in the region, yet it is under-facilitated.
If we had an orthopedic surgeon within our facility here, these cases would be handled here without taking long. However, even those who may be planning to go to Problem Lago or Mbale would even take some time to look for the manner, because the patient may take you, the patient may tell you it may take him like 1 month or 2 months to look for some manner to take him to Mulago.
As the hospital struggles to manage the huge number of victims of the deadly illness, the locals are worried about the future of the children, as this may lead to a disabled generation in future. Elijah Tuliagmanawe, Jordan Mubangizi, NBS Television, Sunset News.